All right. Good evening, everyone. Welcome to our health BioTalk. As promised earlier this week, we said we're going to have an health BioTalk on bacterial vaginosis. Bacterial vaginosis, and I wasn't able to adequately prepare the PowerPoint that I have, so I'm going to use a document that I'm privy to. So I'll use it to do some talking and explanation, and then maybe in the future we'll be able to come up with the images, the accurate PowerPoint. And so forgive me, I just came back barely 30 minutes ago from the events I went to cover, and but since we've already said, let's quickly find a way of doing it. So bacterial vaginosis, most of the time there's always a mix-up between genital urinary infections and infections, and that's because the genital area and the urinary area in the body are very, very close together. So most of the time the infections that is contracted through the genital can affect the urinary tract, and the one being contracted by the urinary tract can also affect the genital part, the genital area. So as we go along with this talk, I'll be able to differentiate between both, and then we'll know that they are quite different, not entirely different, but at least they are still different from one another. So as defined there, bacterial vaginosis is a condition caused by an overgrowth of the normal vaginal flora. Now, that flora aspect can also be referred to as microbiota. They are the resident microorganisms living around the vaginal area. Every one of the earlier talk I've given in microbiosis had to do with normal human microbiota, where I explained that on every part of our skin, or not only our skin, every inch of our body, we have trillions of microorganisms living there. They are part of us. So we have tons on our skin, in our stomach, in our mouth, on our head, every part. So these organisms are part of us, and they exist in a state of equilibrium between ourselves and they themselves. So this equilibrium is being kept in position by our immune system, and the ability to kind of form a symbiotic relationship with us. So they have their so we also provide provide living spaces for them, and of course maybe food to eat as well. So the vaginal area also have its own normal flora. It has its own residence. So now all these microorganisms are being kept in a state of equilibrium. But if anything happens and one of them just grow too much, it becomes a problem. That's the same way in which microbiota, a normal body organism, can also turn against us. So now this bacterial vaginosis is caused by an overgrowth of normal vaginal flora, and of course it's presented clinically as has a fish-like odor. Like I said in the last talk that I had, I said this is actually very common symptoms and sign of course. And I mentioned that a doctor mentioned that if the smell is different, if there's a discharge, you should find a way to get to see your doctor. So most of this particular infection is usually being diagnosed by that fish-like odor, though there are other things that we have to look for in order to make an accurate diagnosis. So discharge is typically thin, gray or white, and women have increased risk of getting STIs when they've been diagnosed with bacterial vaginosis, and pregnant women also have an increase of early delivery when they are already diagnosed with bacterial vaginosis. So we're going to get to all those points later, and then we'll explain. So let's quickly check the etiology. Now, the etiology simply means the causes of bacterial vaginosis. And as said earlier, we said it's being caused by an overgrowth of a normal microflora. So, and although it is not an STI, it's not sexually transmitted, there is a kind of way in which it can also be sexually transmitted, in quotes. It's not an STI, but of course, sexual intercourse will increase but we also those ones later. Let's look at the information we provided here. They said the spread of bacteria among individuals through sexual intercourse may alter the natural balance of bacterial flora within the vagina, and this imbalance appears to lead to development of bacteria. Of course, the thing is, even if it's sexually transmitted, sexual intercourse actually leads to it, because the person that we are having sexual intercourse with may actually be a carrier of that disease, maybe using his genitalia, or maybe using other means, maybe through the finger or something, that eventually will alter the normal bacterial population of the vagina area. And although originally the suspect organism back in those days was Gardnerella vaginalis, but now it has been known that it's not only that particular organism that causes that. No, it's not. We have other bacteria that also cause bacterial vaginosis. And if you look at the point being made here, they said typically this condition is caused by a decrease in the number of normal lactobacilli. Now, the lactobacilli are protectors. They are more or less like the resident, should I call them the residents, the residents microflora, the resident flora. They are the, should I call it, the major microorganism that dominates the vaginal area, and they are very, very protective of the vaginal area. They secrete they secrete some, I don't want to call them chemicals so that people will not get scared. They have this list of substances that keeps the vaginal area extremely protected. That's why they always say that it's acidic in nature. The acidity of what they produce keeps other bacteria at bay, and also keep the population at a balanced level. Now, if there is a decrease in their number, other bacteria will tend to grow because of their absence. So that is one of the things, in fact, that's the major thing that leads to the imbalance in the bacterial population of the vaginal area, and then the infection starts. And as I told you already, it was believed that Gardnerella vaginalis is the but now we've realized that a lot of different bacteria can also cause it. So epidemiologically, well, let's look at this epidemiology. Now, this disease or this infection is a common vaginal infection found in women of reproductive age, sexually active women, of course, and it can occur anywhere around the world. Now, look at the point being listed here. The condition is most common in part of Africa. Well, of course, Africa is usually the, but I don't want to talk about that political statement. But of course, it's very common around there, and they said it's found to be least common in Asia and Europe. Now, even in the US, it still says the most common among non-whites, 51% African American and 32% Mexican American. Those are the people that gets affected most, and the usual age is between 14 and 49 years old. Of course, epidemiologically, women are more likely to report bacterial vaginosis if they had multiple sexual partners, of course. Well, I don't want to use this point because it's going to generate a lot of. They said if they are married or has begun engaging in intercourse at a young age. If they are also sexual workers, and if they practice regular douching. Yes, douching. Please stop douching. I think a lot of women have spoken about douching. That's using, I think, hot flushing water to try and, should I call it, is it sanitized, that I would say, the vagina area, instead of just the regular washing, using soap and maybe some other, just the regular washing is okay. But when all these things, when all these factors come together, the women who practice them are more prone. They are more prone to have bacterial vaginosis. So, as said initially, we said it's caused by an imbalance. Bacterial vaginosis is caused by an imbalance in the vagina microflora, and once there is a change in the population, then there's an issue. Once there's a change in the population, there's likely the possibility of bacterial vaginosis increasing. Just like I've said dominate the normal vagina microbiota. Of course, they are the major they are the major tenants in this area, and but they have their usefulness. So they keep other organisms at bay. They keep them at arm's length. They prevent them from growing too much. But if there is an issue with their reduction, if there's a reduction in the population of lactobacilli, then the infection will start. And you can see that we said that that most vaginosis starts with Gardnerella vaginalis, and it creates a biofilm that now allows other opportunistic bacteria to grow within the vagina. That makes it more complicated. So, of course, they said there's an increased association in bacterial vaginosis and STI, and one of the theories that was being put forward is the fact that bacterial vaginosis is responsible for the presence of enzymes that reduces the host immunity to fight infection. And once that happens, it's very easy for other organisms to actually colonize the vaginal area. So, of course, histopathology. How do you diagnose? If you want to diagnose, you go to an hospital, a sample of the vaginal fluid is taken, and then under the microscope, and then we're going to see these organisms. Of course, the major organisms there. Vanilla is usually rod-shaped bacterium, so you'll be able to see of other cells. Okay, what are the symptoms? What are the symptoms that you can experience if you are infected? If you've contracted bacterial vaginosis, of course, the vaginal discharge, the smelly one, is one of it, and then the discharge is usually much more pronounced as you see here, after sexual intercourse. So if you've been having a discharge and then suddenly after you had sex the discharge increases, then there is a possibility of that. Then the other symptoms include dysuria, this periuria, then vaginal pruritus. So most of these, however, are asymptomatic. In fact, most the usual symptoms being observed is usually that discharge and the smelly one. So the clinical actually partner is okay. Of course, this is just regular. Once you get to the hospital, of course, they are going to try and check the laboratory precisely. Going to try and check if you've had a history of vaginosis before, and then they will now check for other risk factors, which we've already mentioned. What are the factors that increases the risk of somebody contracting bacterial vaginosis? We've already mentioned vaginal douching. We've mentioned multiple sections. Yes, antibiotics use. Yes, antibiotics use is also a major cause. Is antibiotics abuse. When you are taking antibiotics, you need to, if you are taking antibiotics with that prescription, you have to have it at the back of your mind that you are more using antibiotics, because antibiotics directly kills bacteria. So if you are taking antibiotics, it will reduce the population. I said it the other time that once the lactobacilli population in the vaginal area starts getting reduced, there are going to be issues. So when you talk about antibiotics do affect the lactobacilli population as well. So once you are taking them and you're putting all these factors together, then it's likely that the person is actually positive for bacterial vaginosis. And other stuff is cigarette smoking, of course. Cigarette smoking is most of the time even is a risk factor for a lot of diseases. We'll talk about that later. And yes, the use of an intrauterine device, IUD. Okay, IUD is also IUD has a way of offsetting the should I call it the anatomy and physiology of the vaginal area, so it's usually problematic. So they also check for that as a predisposing factor to contracting bacterial vaginosis. So for this reason, of course, vaginal douching is discouraged heavily, and then okay, now this is one of the facts that I want people to also mention. They said having a female sexual partner increases the risk of bacterial vaginosis by 60%. So this for the women, if you have a female sexual partner, it's also a predisposing factor. They said it increases the risk of contracting this infection by 60%, and that's for those who have that. I don't want to talk much about it, but just note it. And it's important to also know that we've mentioned this. It's not an STI. It's not a sexually transmitted disease. It's a genitourinary infection. Okay, this is where they define STI. They said an STI is caused by a source that is not an endogenous vaginal flora. So most of the time, sexually transmitted infection comes from outside. It's an exogenous microorganism. It comes from somebody else. But most infections of genitourinary nature, especially bacterial vaginosis, caused by an overgrowth of an organism that is already present at that place, the overgrowth. So bacterial vaginosis is not an STI. Please, if you we've already mentioned all the factors that could be responsible. Of course, having multiple sexual partners is part of it, but it doesn't mean that it's an STI. Okay, so Of course, when you get to an hospital, these are the diseases. Sorry, these are the diseases that are being excluded in case so that they will arrive at this is what we call a differential diagnosis. So they will try to screen off infections like candidiasis, cervicitis, chlamydia, gonorrhea, herpes simplex virus, and trichomoniasis. If you remember, when we are giving an introduction to genitourinary tract infection, we mentioned all diseases, and we're still going to treat them much more later. So, and now a very important factor is that bacterial vaginosis is a risk factor for PID. PID, we're going to talk about PID later, and it's actually a disease that is very worrisome, not only in women, in also men. Pelvic inflammatory disease is a terrible disease. So bacterial vaginosis is a factor, it's a risk factor, it's a predisposing factor for that particular disease. It's also a risk factor for HIV, other STIs, and obstetric disorder. And it's important to know that to assess for fever, pelvic pain, history of this, to rule out other, like I said, the differential diagnosis, you need to rule out all the diseases mentioned above, like candidiasis, so that you'll be able to arrive at a good diagnosis. And to do that, of course, the cervical swab, vaginal swab will be taken, and then we're going to arrive at. This is for clinical testing. The pH will also be tested. Of course, the pH of the normal vaginal area is usually acidic. That's tending towards the low side. So if it's getting if it's more than above 0, 5.0, 4.5, then of course we know that it's no longer acidic. This acidic nature is being created by lactobacilli, like I mentioned earlier. So if it's no longer acidic, if the pH is checked and we realize that it's going towards neutral or more probably alkaline, then it's also a sign that bacterial vaginosis is possible. So we've spoken about how to actually evaluate for them. You determine the vaginal pH, you take a swab, you check. Of course, there's a positive whiff test where you try to smell it to check if the fishy odor, that fishy odor is there. Once it's there, it's highly likely. And if you look at this, they said we do all these tests, and if some of them are positive, if 2 of the tests are positive, then that's enough to actually confirm the presence of bacterial vaginosis. So let me quickly mention the 3 tests. I think they mentioned it. These are the 3 tests. They call it the Amsel, and there are 4 criteria, and once 3 of them are present, then that's positive for bacterial vaginosis. The first one is the presence of a thin white or yellowish discharge. Okay, so if that one is present, you keep it to a side. Then you check for the cell, the clue cell, the presence of the rod bacterium. You check. If it's also positive, you keep to a side. Then the pH, of course, should be more than 4. If it's more than 4.5, I told you the other time that the regular pH for vagina is around 4.0 to 4.5. So if it's more than that, then there's possibility of it. And then the odor. So that makes 4. Now, if 3 out of these 4 are positive, then there's that's a positive diagnosis for bacterial vaginosis. So the rest are highly technical stuff. The gram staining, these are laboratory work. So let's quickly look at the treatment. and the management of this disease. Now, before we, of course, prevention is possible, but in case prevention is not possible, don't forget that what actually is causing bacterial vaginosis, according to our definition, is the overgrowth bacterial population. A particular bacteria or bacterium or a particular microorganism has grown beyond the normal, should I call it the normal population size that is supposed to be. So the infection can resolve itself. Once you are able to get that balance back, the infection can resolve itself within days or weeks. If you look at all those factors we mentioned above, once most of those factors are removed or they are corrected, like of douching, having less multiple partner, which other one we also mentioned, smoking, removal of smoking, and those likes, there's possibility of the infection. Yes, and stopping the abuse of antibiotics. There's possibility of the infection treatment, but it can also be treated either using clindamycin or metronidazole. That's your regular metronidazole is regular Septrin or Flagyl, I guess. So most of these medication are effective if taken by mouth or applied vaginally, anyhow you want it. So, and they are also safe for usage. So, for usage by pregnant women. Let me quickly look for this. Let me look for this information. So yes, your regular Flagyl can also treat it. That's what I wanted to quickly correct. It's Flagyl, not Septrin. So okay, they said about 10 to 15 women do not improve after first course of antibiotics and may require additional treatments. Of course, definitely. So most of this treatment we're providing here, please, is very important that you approach your physician before doing this. This is not actually what you should do yourself. The most you can do for yourself is to actually prevent the occurrence by reversing all the risk factor that we mentioned earlier. So of course, they said that because it is not an STI, partners do not need to be treated. Of course, you know, STI, once you have it, of course, you're already looking at your partner that you have to both get the treatment. So there's no risk of passing the infection among partners. Okay, so let's look at other information. They say some that pregnant women who are symptomatic for bacterial vaginosis should be treated with clindamycin before 22 weeks of gestation. Like I said, it's important you get in touch with your physician when you want to consider the treatment regime that you should follow. So please don't self-medicate. It's actually very, very, very risky, but you can definitely prevent the infection. So we've already spoken about differential diagnosis. Differential diagnosis simply means that infections that have more or less similar symptoms should be ruled out. So it won't be like somebody is actually infected with an STI and you are treating an STI, let's say gonorrhea or chlamydia, whereas it's just, I don't want to say ordinary I don't want to say ordinary bacterial vaginosis that you're having, but so differential diagnosis must be done, so rule out others. So all other information here are just to educate us. Of course, when you leave bacterial vaginosis untreated, there's an increase in contracting STI. Don't forget that we said some of these the particular microorganism we mentioned the other time produce some chemicals that produce some enzymes that lead to the impairment of the immune system. So once this bacterial vaginosis, once it's occur, there is usually secondary infection that may likely be STI. So those secondary infection will occur because the immune system is already impaired. The both the primary and secondary immune system, especially the leukocytes, the local cell that should have ingested harmful bacteria, will be affected. So other infections are likely to occur. Okay, we've mentioned it the other time that of course that it's possible to have preterm delivery if somebody has a bacterial vaginosis. It's possible. They said particularly if bacterial vaginosis is diagnosed in the early second trimester. And then there's also the risk of spontaneous abortion in women diagnosed with bacterial vaginosis in the first trimester. So, of course, we said the infection can resolve itself. It doesn't dangerous. If it's not dangerous for the women, it might be dangerous for their child, for their pregnancy. So, okay, what other factor do we want to consider? Okay, so we said bacterial vaginosis is a common presentation in clinical medicine. Of course, it's one of the most commonest. It's one of the commonest rather. And health workers and nurse practitioners see patients with which should always assess the presence of other STIs. Yes, this is just the summary. It's very important. Don't be treating something else when you are supposed to treat another thing. And then said bacterial vaginosis during pregnancy is associated with high rate of preterm delivery and spontaneous abortion. We've mentioned it. So it's extremely important to screen for bacterial vaginosis when being pregnant. Please, it's actually very good. If you are pregnant and you are seeing all this, okay, let's put it this way. If you are pregnant and you are practicing all those risk factors that we mentioned earlier, please try and stop them. Not actually good. So you try and stop them. I'm going to go back to those factors very immediately after now, so you'll be able to see them. Also, if you are pregnant and you've already been seeing these signs and symptoms, the signs and symptoms that we mentioned the other time, please, it's also very important that you screen yourself for bacterial vaginosis when you are pregnant, so that you get good treatment, and then there won't be high risk of having preterm labor or falling into preterm labor and having preterm delivery and spontaneous abortion. So once again, let's go to those risk factors. Let's go to those risk factors so that we'll be able to call it a day. Where are they? Okay, this is usually the risk factor. If you are practicing all these factors, by multiple sexual partner, antibiotics abuse, cigarette smoking, and then the use of IUD device. IUD is already D is already for device. Don't mind me. So if you are exposing yourself to all these risk factors, so it's actually whether you are pregnant or not. So thank you. I hope we're able to learn a thing or two from this Health Talk. We will be answering questions below in the comment section, and next week we'll be treating one of that topic. Like I said in that topic, please, if you have another topic you want us to treat in mind concerning genital urinary infection, please get across to us. This topic was treated on demand from patients Joseph Maman. Thank you very much. I think you are one of the audiences already. So if you have another topic in mind, to everybody else in the house, let's know about them. We'll be able to treat them next week Friday. So till then, make sure you take care of your health. Don't do what I wouldn't do. Take care and have a lovely night. Bye.